Hi, welcome everyone. My name is Mary Koshi, and I'd like to welcome you to the Office for Diversity and Inclusion's virtual speaker series to raise disability awareness. And as you may know, this month, October, is Disability Awareness Month. And we have with us today representatives from the Mayor's Office for People with Disabilities. I will turn it over to them to introduce themselves, but I wanted to give you some logistical information. As you can see, we have American Sign Language interpreters with us today, and also we have live transcription. If you go to the bottom panel on your Zoom screen and click on the CC closed captioning button and show closed captioning, you'll be able to see the conversation today. And we also have a QA function ready for you. So as the presentation is going forward, if you have any comments or questions, please put them in the QA function. We'll try to answer them as we go along, time permitting. Otherwise, we will get to your questions, as many as possible, before the end of the session today. So with that said, I'm going to pass it over to Eli Ramos from the Mayor's Office for People with Disabilities. And welcome.
All right, thank you, Mary. And thank you, Sinai, for that funky interlude. Definitely enjoyed that. Great way to start us off. My name is Eli Ramos. I'm the Business Engagement Associate for the NYC at Work Employment Initiative here at MOPD. And, Mary sort of walked us through the access check. But yeah, as we move along, feel free to throw questions into the chat. We're going to try our best to either answer them as we go along, or towards the end, we'll set some time aside, time permitting, to answer some of your questions. All right. This is our basic contact info here. And so before we begin, I think it's important we just establish definitions, right? Actually, before I go into that, let me self-describe. This is something that we encourage everybody to do in their presentations, is to give a visual description of themselves so that members of the blind and low vision community, and also people that are just following along on their cell phones, feel included in the presentation from a visual standpoint, right? So I am a Latino male. Dangerously approaching 30. We're a month away. I'm wearing a blue sweater. I'm wearing a rugby scarf, as they call it. It's a little chilly in the office. Black hair, olive skin. I'm sitting at my cubicle here at MOPD. We are back at the office, at least in part. So anyway, back to the definition of disabilities. The Americans with Disabilities Act, ADA, defines a person with a disability as a person who has a physical or mental impairment that substantially, note that word, substantially limits one or more major life activities. Now, these major life activities include dressing, eating, drinking, basically your daily life activities, right? And this includes people who have a record of such impairments. And we also have the NYC Human Rights Law. And that law defines disability as any physical, medical, mental, or psychological impairment or a history or record of such impairment. Notice that the word substantially is not in this definition, which means that the NYC City Commission on Human Rights Law is actually more protective than the ADA itself. So important to note that. So we're gonna go into some statistics, New York City statistics. And here's our nice pizza pie of the population of New York at about 8,500,000. And that blue pizza slice up there is the number of people with disabilities, just at about 11% and just shy of 1 million. Granted, with the linear progression of time, that number is going to go up naturally as we move along. It's also worth noting that some people don't know that they have a disability. It's also worth noting that some people choose not to disclose that they have a disability. And so when we factor all that in, we can only naturally assume that this number is actually a bit on the low end, could be much higher. Now, on the flip side of that same coin, you also have individuals that have more than one disability, right? You could have, say, a spinal cord injury, but also have a mental health concern, right? But based on how people disclose, this is the breakdown of disability types here in New York City. And you'll see that ambulatory disabilities, such as the one that I have, I failed to mention that in the description. You don't see the wheelchair in the frame, but I do use a wheelchair. The ambulatory disabilities take up the lion's share of this pie, right? At 29%, just shy of 600,000, right? And you see the other breakups here as well. So here at the office, we do an annual report called Accessible NYC, which we're actually in the middle of compiling right now. It's that time of year. Also, there's a new administration coming in, so we are working to put this out before the year's end. I mean, we have some screenshots here of what that report looks like, but it's essentially a comprehensive report about accessibility in the city, right? And we break this up in different pillars. The 8 pillars that we at the office try to address day in and day out. And here they are: transportation, employment, financial empowerment, education, technology, housing, health, and access. Specifically, access to city services, making sure that, as the commissioner says, New York City is the most accessible city in the world. And you'll be receiving this PowerPoint at the end of the presentation, but the full Accessible NYC report, at least last year's report, is included in the hyperlink right there. Okay, so we're going to go into specific pillars here. This is transportation, right? You notice a lot of new accessible stations popping up around the city. Here's one. This is the Hoyt Skimmerhorn station in, I guess you could say, downtown Brooklyn-ish. You'll see additions and reparations of elevators and ramps. This was a newly installed elevator here. You'll also see some increased signage. Our office is right by the Fulton Street station. And, if you take a stroll through the station, you notice, all these different signs now that really serve the deaf and hard of hearing community and make it easier for these individuals to navigate the transit system. Similarly, you hear more frequent announcements for incoming trains, for changes in service, and this specifically, well, I wouldn't say specifically, but most beneficially addresses the blind and low vision communities. We also see an expansion of service for the ferry, offering more alternatives for people with disabilities to get around. Specifically, in the coming months or so, we'll see the launches of 4 different lines servicing hard to reach communities such as Soundview, South Brooklyn, Coney Island. Rather than take that Q train all the way down, now, people with disabilities might opt for the ferry and take the more scenic route. Okay, so we're gonna jump into employment here. Employment is something that, that I focus on here at the office, that Crystal focuses on here at the office. NYC at Work, it's our employment initiative. You see some of our job seekers here pictured in different capacities of employment. And in the program, we recruit, pre-screen, and connect New Yorkers with disabilities to different job opportunities and internships. And we do this through a wide network of partnerships in public sector, in the private sector, and also in nonprofit sectors as well. So here we have some trends, pre-COVID and also current trends, right, when it comes to employment here in the city. In 2018, for example, there were approximately 1 million working age adults with disabilities in New York. The employment rate of working age people with disabilities was 33, and people without disabilities, 75. That's pretty much a 200% increase there. And also, people with disabilities are more than twice as likely to live in poverty. So that's even more of a challenge that we face here at NYC at Work when we're trying to employ our constituents. Unemployment rates for New Yorkers with disabilities increased more quickly during COVID-19, and they've remained the highest they've ever been, right? So between April 2020 and March 2021, the unemployment rates for people with disabilities came in at about 16%, and that's an increase of about 9% from the previous year. And the unemployment rate for all New Yorkers as a whole is 11%. So again, you see that huge disparity between people with disabilities and people without disabilities. So COVID brought us a bit of a silver lining. Here we are in this virtual space. This is something that the disability community was advocating for a long time. And, from pressure comes diamonds, and here we are. We're forced to use this virtual space because, you got to keep the lights on, right? But in 2021, NYC at Work, we actually were able to hold 550 virtual meetings, something we're very proud of. And this ranged from orientations, workshops, informational sessions, council meetings with our business partners and other coalition members. And we've had 3,000 participants to date. So here are some of our success stories. And I think a great person that could speak on this is my colleague, Crystal Rivera, who is actually one of our success stories on her own right. So Crystal, I'm going to pass it on over to you.
Thank you, Eli. As Eli said, my name is Crystal Rivera. I'm the program officer for Empowered Cities at the Mayor's Office for People with Disabilities. I'm going to give my visual description. I am a Latina woman with dark black hair pulled back in a ponytail. I have cat eye glasses, a white dress with blue flowers, and a beige blazer. And I can definitely say I'm one of the success stories of NYC at Work. As a former job seeker, I began looking for new employment in 2017. I worked at the Independent Living Center prior to looking for that employment. And I was just casually Googling employment help for people with disabilities when I stumbled upon NYC at Work. I filled out an a job seeker referral form, and there goes my journey. After that, I met with a relationship manager who was gracious enough to help me tailor my resume and help me seek suitable employment. At first, it was rather a daunting task of knowing that I would be leaving a small agency and seeking something new, as I had been there for 5 years before seeking new employment. But through hard work and perseverance and working on my materials, I was able to land employment at the New York City Department of Consumer and Worker Protection. And I was working there for 2 years on a program that I will speak about a little bit later in the slides. But I want to end it by telling you that through that position, I was able to attend over 170 events, reaching people with disabilities citywide. And because of that, I was asked to join the New York City Mayor's Office for People with Disabilities. Next slide, please. So the program that I was chosen to work on as part of the New York City Department of Consumer and Worker Protection is a program that's very needed by people with disabilities. This program is called Empowered NYC. Empowered NYC offers free financial counseling for people with disabilities and their families. Next slide, please. Empowered NYC is an initiative that offers New Yorkers with disabilities and their families the ability to take control of their finances and improve their financial health. The way we do this is rather unique because we have financial counselors through the Financial Empowerment Center, but our financial counselors in Empowered NYC have specialized training to understand the complex financial needs of people with disabilities. This training allows them to understand federal and local benefits, as well as work incentives on top of the traditional financial counseling training, such as budgeting, repairing credit, building credit, finding affordable and safe banking options, and much more. So financial counseling is provided through confidential one-on-one service. Because of the pandemic, we're able to offer this counseling via telephone in this new state and age. When we could have just not offered the service at all, we have made it more convenient for New Yorkers to access this service. Next slide, please. The way you are able to make an appointment with an Empowered NYC counselor, if you have questions about how working would affect your benefits, how you can save money, how you can repair credit, how you can build credit, or even if you just have a question about a future goal, you will visit our webpage. That is nyc.gov/Empowered NYC, and you will be able to see our appointment scheduling page, and you are able to book an appointment with a financial counselor through that portal, and then you will receive a confirmation email with the next steps. So as a former Empowered NYC staff member, I highly recommend this service for anyone who wants to better take control of their finances, because I was not only the program officer for that program, but I was also a client. And just to give a brief scenario, I was able to save $10,000 towards my wedding with the help of an Empowered NYC counselor. Next slide, please. So another really important program I work on as part of the Mayor's Office for People with Disabilities is connecting people to access to technology. During this time of the pandemic, a lot was realized, and we had realized a lot of our job seekers were working on job applications and submitting resumes through their mobile phones because they did not have access to technology. They oftentimes had difficulty attending Zoom meetings and other things that were required. So we decided to do a survey of all our job seekers. We actually surveyed around 700 to 800 job seekers. And we found that a lot of the job seekers had poor internet access. They had limited use of working computers or access to working computers. They heavily relied on their cell phone for computer tasks. If they did have computers, they lacked digital literacy training. They lacked the knowledge and etiquette concerning virtual platforms. And they had no accessible way of accessing those platforms. So we decided, through the help of funders and donors, to start a program where we would provide access to laptops, prepaid internet, and employment trainings to those in need. And I'm happy and proud to say that we are on our second cohort of people who are participating in this program. And hopefully we can continue to close this digital divide by providing this useful service. I'm gonna pass it back over to Eli so he can discuss education a little bit more in detail. Thank you.
Great, thanks, Crystal. Yeah, it's amazing stuff that's coming out from the financial empowerment and also from the connected bill IT programs. You know, and education, we think of education, financial empowerment, and also employment as sort of being a three-legged stool, right? It's to say that without one presence, the structure cannot stand on its own. Specifically, those three are very tied together. You know, and we have partnerships with District 75. Obviously, that's, you know, through the New York City Department of Education, but also with the colleges, right? So CUNY Leads. CUNY Leads is a program that services people with disabilities in the CUNY system. And you know, as a whole, we also have a college coalition where you know, we connect students with disabilities from public and private colleges. So not just CUNY, now we're talking SUNY, we're talking, you know, St. John's, Fordham, et cetera, Columbia. Yeah, these are all offices where we, you know, try to find the next generation of employed people with disabilities, right? We also have internship to career pathways, something that my colleague Tara was spearheading. She has since moved on to her dream job as a guidance counselor for one of the schools servicing the largest population of people with disabilities. But the internship program does live on, and we've, even in COVID times, been able to connect individuals again remotely. That's the beauty about this remote stuff, is that, you know, a person like myself could work from home and still contribute. We've done different trainings, you know, such as this one. This was kind of catered specifically for you folks at Mount Sinai, as part of your celebration of disability employment, disability awareness month. But we do, and we have done in the past for Sinai, presentations on disability etiquette and awareness. That covers, you know, general language and best practices for communicating and working and interacting with people with disabilities. And we also have different digital accessibility trainings as well. So that's our education piece. Okay, a little bit of a lag there with the PowerPoint, but for housing, I'm going to go to the resident expert here, Mr. Arthur Jacobs. Arthur, take it away.
Thank you, Eli. My name is Arthur Jacobs. I'm the housing coordinator at the Mayor's Office for People with Disabilities. One moment. Okay. So housing in the city right now, you know, we continue to develop new accessible units through the set aside program in the affordable housing lotteries. That breaks down to a 5% set aside for people with mobility disabilities and a 2% set aside for people with vision and hearing disabilities, vision and or hearing disabilities. Those set asides are available through the lottery units. And one of the things on the here is the new Housing Connect that provides more accountability for landlords and developers on re-rentals of those set aside units. So Housing Connect will now be tracking those things. At the beginning of COVID-19 pandemic, the city and state both placed a moratorium on evictions and foreclosures and utility shutoffs in order to help folks who were impacted by, by losing their employment and so we also are, continuing to monitor that as things move forward. One of the newest things is the emergency rental assistance program that has come about from the federal stimulus packages that have come out recently, which is administered by the state. And as mentioned, HPD launched Housing Connect 2.0 in July of 2020, just a few months after the pandemic hit. And this provides a system that streamlines the application process. Applicants are now able to upload documents directly into the system and update their applications in real time. Before, once you submitted an application, that was it. You couldn't update the information until you were called for an appointment, and only some of it could be updated. Now you can go in, on the fly, update your profile and just keep it all current as you move through the process. And then, as mentioned, the set-aside units are now being offered as re-rentals through the system to ensure that people with disabilities remain in those units. Next slide. All right.
Yeah, sorry about that. There's a bit of a lag with the PowerPoint here, but we're trying our best.
All right. All right, so communication access. One of the things that we have strived to do and really do throughout is encourage the city to, as Eli said earlier, make the city as accessible as it can be. And one of the ways we did that was getting live captioning, human captioning, and ASL for the mayor's press briefings. He had it at some of them, but really when the pandemic hit and he was doing daily briefings, we made sure that the ASL interpreter and the captioner were there for all of his briefings. We worked with DOHMH on making sure that their materials were digitally accessible. They were putting out a whole lot of information, still are, and we wanted to make sure that that material could be accessed by everybody. We also worked with DOHMH and other agencies on making sure that their social media was also digitally accessible through the use of alt text descriptions on images. And we, in the beginning of the pandemic, we had weekly meetings with the disability community to provide updates on the city's response and hear concerns directly from the community on, how they were being impacted. Next slide. So these calls were really a way for the city to update the community. We had representation from the health department, emergency management, and HRA regularly. We also have, recently we've had representatives from the MTA, DOT, the Get Food program when that started. We've had Board of Elections and Campaign Finance, DOE in recent months. That call has gone from a weekly call now to a monthly call. We still provide ASL and CART at each of those webinars. The transcript is provided afterwards, the Q&A, the chat, all of the resources that were provided during the webinar are shared afterwards as well. Crystal and I run that call now, so It's really just, it's a great way to hear from the community, their concerns, and to give us updates also on what their, the community organizations are doing as well.
Arthur, there's a question in the Q&A about more.
Mhm. I'm sorry, about what?
Are you aware of any, there's a question in the Q&A, you mentioned that rental assistance for those impacted by COVID. Are there any programs that provide mortgage assistance for those impacted and are disabled by COVID?
That is a good question. I'm not sure if the ERAP program would cover mortgage assistance or not. Yeah, I'm not certain about that.
Do you know where we can refer this individual, or is there a number that we can reach out and find out?
I would start with the ERAP website. So if you just Google New York State ERAP, you should find the webpage for it. I would start there. They've got a toll-free number you can call, and I think they would probably have the answer.
Thank you.
All right, so I think I'm going to be passing it back to Eli for the next slide. Yep.
Sure. Yeah. Thanks, Arthur. Yeah, regarding that question, I think we mostly, being an urban center, kind of deal more so with the rental side of things. So, yeah, I would definitely trust the state guidance for an answer on that. But that is a good question. Yeah, it's definitely a good question. So, more specifically, what COVID did was sort of expose a wound, I guess, for a better sense, for lack of a better term, to some of the disparities in medical care, as you all probably know better than I do. One thing that came about from these community calls, as Arthur was mentioning, we were receiving complaints and concerns about perhaps a fear of rationing due to the disability. So in a scenario where someone with a disability might have been overlooked over someone without, for example. And these things are kind of hard to quantify. It's all anecdotal. And it's also, there are two sides to every story, yada, yada. There's a lot of components that come into these kinds of claims, but nonetheless, we were hearing this, ever so frequently in our calls with the community, in our calls through 311, who our colleague Edwin, who just walked on, actually, handles day in and day out, receiving calls from the community. So it is something to sort of be mindful of at the very least. On the flip side of that same coin, for those of us who live at home and rely on home healthcare providers, the community was facing losses in that as well. Be it that there was a concern from home health aides about getting sick, and thus they, either quit the job or, didn't report for work, what have you. Concerns from the clients themselves for being exposed. Here I am quarantining, but there's a person coming to my house every day, and sometimes I don't know that person at all, and other times, I just don't know what's going on. There was a lot of that concern coming to us as well. And also, for those that were unfortunate enough to lose their jobs, what happens with the insurance? What happens with coverage? And even a week sort of layover between figuring out what the next step is in that process is a make or break situation for somebody who relies on care. As I know, some individuals rely on it 24 hours a day. And that presented a lot of challenges at the beginning. We also saw disparities in accessibility. You know, that the vaccine sites weren't always accessible. The city provided a hotline for individuals to self-report and make claims to try to get that fixed. And you know, as Arthur was getting into before, that also included on the virtual space as well, making sure that that online booking portal was accessible to people that use screen readers, for example, and you know, people who rely on speech to text, either for you know the same reason or for another you know, other forms of disability. And ASL availability on site at these locations, that was an issue. We've been trying to improve that as best we can, but unfortunately, sometimes, again, not everyone discloses their disability. You might show up to a location, they didn't necessarily know that you were deaf or hard of hearing, and now there's a lag in communication, right? Something like that could easily happen. We also saw a lack of access to PPE. So we as an office fought very hard to make sure that PPE was getting to the right folks. We set up a website for people to, you know, sign up and receive these PPEs. And we also made it a point to get clear face masks for the deaf community. And this work got cut off, but that's also for provider partners that work with this community specifically. And you know, the reason for that, of course, is because you know this community relies a lot on any sort of non-verbal visual communication. So you know, having that clear face mask is so very important for this community to be able to communicate effectively. Something that is not easily done with a conventional mask that you see most people using. And here's some numbers for the total, you know, supplies that we were able to give out or have given out thus far. You know, masks at about, you know, 325,000, gloves at about 450, clear masks just under 12,000. And I'll tell you, a lot of these materials were delivered by our own staff at times. We'll get into that in the next slide, I believe. Similarly, food, access to food, these same mechanisms were in place to get meal deliveries for people with disabilities, for seniors. We partnered with the TLC drivers who had seen a hit in their numbers as well. Everyone was indoors, no one was going anywhere. The drivers were suffering as well. So through a partnership with TLC, we made it possible for these deliveries to happen safely, and the drivers certainly appreciated the business as well. Meal pickups at 400 and plus Department of Education schools. We delivered, as a city, delivered 1 million meals to people who were unable or unwilling or didn't have the wherewithal to leave their homes. And we also connected with the nonprofit sector to ensure those deliveries were being made. So very comprehensive effort to keep bellies full and people healthy. This is sort of an end piece here, but mental health and domestic violence, you know, with the good always comes the bad. We saw an uptick in domestic violence cases. People that weren't used to spending time with each other were now being forced to spend time with each other all day. Things happen. You know, the stresses of life are enough to kind of bring someone down at times, but you know, you add in a global pandemic in there, and there were some mental health concerns that came from this. You'll be getting the PowerPoint. There's a list of resources mental health resources for people with disabilities here. And, you know, the reason why this slide isn't as put together is because we usually defer to the Thrive Network for this. That's the First Lady's initiative, but, you know, we try our best to at least put the resources out there so that people know. There's also barrier-free living. They offer comprehensive support services for survivors of domestic violence with disabilities, people who are at risk, and they do fantastic work as well. And the website is there below as well. That actually concludes our presentation. So at this point, we're just going to open it up to questions. Feel free to post questions into the chat, and the three of us collectively will answer as many questions as we can in the 15 or so minutes that we have remaining. So Mary, I'll pass it back over to you.
Thank you, Eli. So please, if you have questions, use the QA function. So while you all get your thoughts together, I want to thank our representatives for joining us today and sharing some of the things that the city has been doing since COVID to address the needs of people with disabilities. I do have a question for the group. Have you, from the disability community, have you heard any concerns about vaccine hesitancy? You know, is there a number that you can provide in terms of what percentage of that 11% are vaccinated? You know, we talked about how access is an issue, so yeah.
Right, and those were numbers that we were trying to compile for this presentation. We don't have the numbers specifically for disability. What we do have are the citywide numbers. So that was, I believe, 5 million or so have received both doses. And I believe it was 8 million or so, correct me if I'm wrong, somebody, doses given out as a whole. And again, part of that logistical challenge of obtaining that number is, for one, you know, as I was saying before, some people don't disclose, right? And then for two, there's also just a logistical challenge of trying to get the numbers together, you know, and to make it available to the public. But that's something that we could certainly come back to and update you guys on in a future presentation.
Yeah, sure. Has there been any concerns about hesitancy among your constituents around getting the vaccine?
Oh, certainly, like with any community, and especially when you consider that disability is only one aspect of an individual. There's, you know, there's cultural differences. There's, you know, race, religion, all of this makes up who we are, right? And disability is just one aspect of that. But I would defer to Arthur and Crystal, who hear from the community a little more directly than I do on these weekly calls. I guess, you know, to complement Mary's question here, what are some of the concerns that you hear directly, you know, week in and week out on these calls?
Well, we do hear a lot of fear. There's a lot of misinformation being passed around. A lot of hesitancy from people that have like multiple conditions. They feel afraid of getting the vaccine to worsen whatever conditions they may have, or they feel that I've heard that they feel that they will get COVID because of the vaccine. I don't know if Arthur has heard differently, but I know there's a lot of misinformation out there in the community. And that's why during the calls, we oftentimes have the Department of Health speak on the real information that we want to be given out, because we don't want this misinformation to continue. So Arthur, do you have anything you want to add on that question?
So I think you covered it pretty well. I think that for folks who have multiple conditions or feel like maybe in the past vaccines haven't been something that they've been able to tolerate because of their conditions, they automatically assume this one is also going to be that way. And they don't even necessarily check with their doctor about it. They just make that assumption. And so encouraging them to really speak to their doctor and have that communication and figure out whether it would be appropriate or not is something that we always try to do. And then there's also, for those who really can't tolerate the vaccine, there's a lot of concern about, how they're going to kind of weather the pandemic, and what kinds of services are going to remain in place, or options are going to remain in place for them to access things, in an alternative way that doesn't involve, being around lots of people and that sort of thing. So, yeah, there's definitely a fear out there.
Yeah, I think, to add to that, Arthur, I know of people personally who, since pandemic started, haven't left their house just because of the fear or because of the disinformation that Crystal was talking about. And all you could really do is try to, convince, try to sway them one way or the other, but every mind is a universe, and so we also have to respect people's individual decisions and situations and what have you, and that presents a challenge in and of itself, because as a society we're just trying to get better, but we still also have to be respectful and mindful of each other.
Eli, anyone can answer, but this question came up. It's I guess about the precautions to prevent the spread of the virus. Have you been able to partner with the MTA or police to enforce mask wearing in public? Seems the mayor has a mandate to wear masks on public transportation, but no enforcement. So I guess the question is getting at, has there been any public education or promotion of wearing the masks in partnership with other enforcement agencies?
Sure. I guess citywide throughout all the agencies, we have our mask guidelines here at the office that we have to follow. We need to, present record of either immunization or, a recent result, test result to even get into the building. So that exists, citywide, agency-wide. But Arthur, Crystal, I don't know about anything specific with MTA or NYPD in that respect. I don't know if you guys have any thoughts on that.
I know that certain aspects of public transit are, I think, enforcing it more than others. For instance, the NYC Ferry, which is considered public transit, has very strong enforcement of mask wearing. They won't let you on, on the boat if you don't have a mask. It's just as simple as that. And they make sure they tell people, this is the law. You can get a fine if you don't have it on. I think that also happens more on buses as well than subways. But yeah, it's one of those kind of sticky situations, I think.
Yeah, to echo what Arthur said, definitely for the buses, because there's more control as to who comes in and who doesn't. For a crowded train during rush hour, it's tough, as Arthur says. It's tough logistically to do that. I think what you see more in the trains, and I ride the train every day, but what you see in the trains is more of like the self-policing type thing, where people kind of either give you a glance or outright tell you, hey, put the mask on. This is a crowded train we're on here. You need to do your part. And, that doesn't go well sometimes. We don't want to promote vigilantism either, but these types of things definitely happen. Once you talk about, trades during rush hour, for example.
Thank you so much for that answer. Any other questions? Okay. Oh, something came up. On that note, will the city continue to provide masks on buses and in train stations? I don't know if this group can answer that question, but Eli or Arthur, what do you think?
Based on personal experience, I mean, I like I said, I ride the train and the bus more so than, I guess most people in my situation, if that makes any sense. But there have been times when, say it drops on the floor and the bus driver is nice enough to give me one, but it's not a guarantee. I mean, they need the supplies themselves. So
Yeah.
it's really a question of availability.
Yeah, and I know some of the train subway stations have the vending machines where you can, get the supplies yourself.
Right.
All right. So, and I also want to put a plug in for Access VR and MOPD. We partnered with both those groups this summer. The Office for Diversity and Inclusion. We had 2 summer internships through that program. So I'm going to just shamelessly plug our ODI Talent Pipeline program, where we had a pilot program this summer for interns with disabilities, and we worked with the mayor's office for people with disabilities to place 2 individuals this summer. So next summer, if you would like to sponsor and host an intern with a disability so we can improve access and economic independence, please reach out to me and let me know. All right, so thank you, team, for joining us, and thank you for everybody that was able to hop on this webinar today. A live recording of this will be made available, as well as a transcript. I will email that out to everybody once that is available. And Eli, please send me the PowerPoint when you are ready with it, and I'll also distribute that to those who registered and could not attend as well.
Sure, will do.
All right, thank you, everybody. Have a great day. Bye-bye.
Thanks, everyone.
Thanks all.